So I'd like to show you guys how I recommend preparing for clinic. So it depends on your schedule and how busy things are when you prepare for clinic. It could be anywhere as long as a week before the visit, but more likely, given your inpatient schedules, probably a day or two. You'll have some time to when you have some time to go into the chart. So you'll pull up your patient's name. You'll go into the chart, and what I recommend is starting a basic note prior to the visit. So you'll click on New Note, and this is where you'll click again on the one tickler note. So I've often described the one tickler as the creepiest of all the note titles, but nonetheless, it is the one that we have settled on, and it is what I recommend that you use for preparing for clinic. The reason that I recommend using it is because it's a private note that only you can see, so no one else can see what you write on there. And probably more importantly, it does not show up on any reports. And so, if, for instance, the patient no shows or cancels and you forget to delete your note, um, it will not show up on the so-called error report. The business manager will not be upset that you haven't written your note. And so you can also keep it as a one tickler until the patient arrives. Eventually, the patient will show themselves in clinic, and that therefore you won't lose all the work that you've done. So I really encourage you to use the one tickler in preparing for clinic. In a later tutorial, I'll show you how it's very easy to convert the one tickler to a primary care progress note, which is ultimately the note title that's going to go into the official record. So you will click on one tickler. So that will load the note. Unfortunately, the pre-populated text, again, you'll have to delete it. There's no way around that. And again, most of your visits it will be predominantly men and will be predominantly follow-up appointments. So you will most commonly be using the male interval visit update. So you'll click that in. That'll load your template in here. I strongly encourage you guys to try to write the note as much from scratch as possible. Um, we are all aware of the issues with copy and pasting. Not only the ethical issues, but also the issues of um, making it very difficult to find exactly what's going on with your patient when there are things that are copy and pasted from months and years ago. So I really think that when you're writing your note, really giving a concise synopsis of what is going on currently really provides the most information for others when reviewing the chart. So we are not looking for novels when you write your assessment and plan. Quite honestly, a few quick lines for each problem is perfectly fine. We'd rather see that, sort of written from scratch than copy and pasted novels of things that have happened, 5, 10 years ago. That's just not as important and creates a lot of extra noise in the chart. So there are two things that I do copy and paste, which is one, my one liner, which I spend a lot of time creating, and I think adds a lot of value for people who may be coming into the chart who don't know my patient. So I will copy the one liner from my last note. The other thing that I will copy is my preventive medicine. Again, I spend a lot of time keeping that up to date, and so I copy and paste that from my last note. Other than that, I will write the HPI and I will write the assessment and plan really from scratch with the most active and important topics. So, in terms of how I prepare my one tickler, what I do is I generally read my most recent notes. So, let's say, for instance, here I last saw a patient on November 12th of last year. I'll read my note to sort of remember what I did at that visit. And then I'll read all the notes that have happened in the interval to sort of see what's happened with my patients since I last saw them. And that helps me to create what I call my agenda for the visit. So, these are the things that I hope to discuss with the patient. Of course, they might derail that and have a new complaint that trumps what I have to discuss. But this is in a perfect world the things that I would like to discuss. So, for instance, this patient has chronic low back pain, and we've been working on that. So this will be, I would write, how is low back pain? And that helps me to remind myself that those are one of the things I want to talk to. If my patient has poorly controlled diabetes, I would write, how are blood glucoses? If I wanted to get labs on a patient, I might write down exactly what labs I plan to get. So maybe I plan to get a CBC, a Chem7, an A1C, and lipids. And so when I come into the visit, I have a good understanding of what I want to talk about. And then, of course, again, the patient may have different things to talk about, and we will address those at the visit as well. And so there's two ways to save your one tickler. Uh, Either you can right click and do save with signature, or you can do file, refresh patient info, or select new patient. In either case, you'll hit don't sign. And so the note will be saved. And then when you come to the actual clinic day, you'll be able to click on the one tickler note in your notification tab and enter the note. Once you enter the one tickler note, you will just have to right click and do edit progress note, and that will allow you to type directly within your note.